Good afternoon, everyone. I know that we are at the top of the hour, but we still have many individuals entering the meeting, so we'll wait just a moment until that volume slows down a little bit, and then we will get started. Good afternoon, everyone. While I know that there are still several individuals continuing to join, we'll go ahead and get started. I want to welcome you all to the budget overview for our partners and stakeholders. For today's presentation, because as you can few minutes or so to answer questions. The meeting chat is disabled, so if you have questions that you would like answered at the conclusion of this presentation, please send an email with your question to budget@mha.ohio.gov. We have staff that are actively monitoring this email account, and at the conclusion of this presentation, they will either ask your question, or if we are unable to answer your question during the time allotted, we will respond to the questions as soon as we are able. Also, if you would like to reference something later, know that this webinar is being recorded and will be posted on our website. Finally, if you would like to watch with live captions, you can click on More along the top of your screen, then scroll down to Language and Speech and turn on live captions. Again, if you have questions during this presentation that you would like to ask, I once again want to remind you to send those questions to budget@mha.ohio.gov. At the conclusion of this presentation, staff will ask questions that they have time to ask, and all others will be responded to when we are able. Moving on. I hope you all were able to watch or listen to Governor DeWine's press conference Monday afternoon, where he laid out his priorities for his final state operating budget as governor. During that press conference, Governor DeWine reaffirmed his commitment to increase access to mental health services directly in our communities, building the system of care that was promised in the 1960s, but was never fully delivered. He reiterated that since taking office, his administration has worked alongside the General Assembly to invest the necessary resources to make Ohio a national leader in addressing the mental health crisis. He then shared quite a list of accomplishments that we all collectively have achieved over the last 6 years. So I want you all to take a moment and reflect on these accomplishments, because this is an unbelievable testament to the amazing work of this field in such an incredibly short period of time. Just since 2019, we have opened Ohio's first new state psychiatric hospital in nearly a decade, with plans to build more of them in the coming years. Since July of 2022, our 988 Crisis and Suicide Lifeline has received more than 440,000 calls, texts, and chats. That's an average of more than 18,000 communications every single month, and that number continues to grow. We've served nearly 16,000 youth and families through our new mobile response and stabilization crisis service. We've attracted more than 2,100 behavioral health professionals into the field through our Great Minds and Welcome Back programs. We've also helped to construct or expand 11 pediatric behavioral health facilities, which served more than 100,000 youth last year alone. We also launched 26 new psychiatric residential treatment facility beds. For those of you who may not be familiar, this is an extremely specialized facility for youth with the most complex behavioral health needs. Prior to 2024, this service didn't even exist in the state of Ohio, and youth in need of this kind of care had to go far away to states like Oklahoma, Tennessee, or Pennsylvania to get the behavioral health care services that they need. We are in the process of constructing and renovating 26 new crisis facilities, including 4 behavioral health urgent cares in partnership with our county boards and providers. We've added 87 specialized court dockets that are helping more than 36,000 participants to achieve recovery. We've partnered with Hazel Health to serve 160,000 youth in underserved communities with behavioral health telehealth services. And our amazing recovery services staff have treated nearly 50,000 men and women with substance use disorders in Ohio's 28 public and private prisons. The governor's budget continues to build on the things that make Ohio the heart of it all. Our children, our families, our people, our workforce, our businesses, and our communities. And I think what makes OhioMHAS, our providers, our boards, our stakeholders so special is the work that we do every single day impacts every single one of these. We can't have healthy children and healthy families without resiliency. Our people can't be contributing parts of the workforce if they're struggling with barriers because of their behavioral health conditions. And our providers that are the lifeblood of many communities are truly small businesses. So our work impacts every single one of these governor priorities. So before we jump into the key areas of the OhioMHAS budget, I want to give you all a bit of context. This budget is really informed by the needs of our communities. Shortly after being appointed director of OhioMHAS, I made the point to get out into the community. We convened a statewide listening tour, and there are a few photos from that tour on the screen in front of you. As part of our statewide tour, we met with more than 70 different stakeholder organizations, hundreds of Ohioans. And I had the privilege of traveling almost every single corner of this state to meet with board directors, providers, sheriffs, judges, many of you on the call. I even got the opportunity to sit down with every single one of my central office staff and many of my hospital staff and prison staff. I also had the incredible honor of talking with families and individuals with lived experience. All of these conversations illuminated the exceptional work happening in this field every single day, as well as the unique needs and the opportunities to connect more Ohioans with the quality care that they deserve. This budget builds on 6 years of progress under the DeWine administration. It prioritizes efficiency, quality, and accountability. It scales successful programs and gives greater flexibility to our local communities. And it lays the foundation so that all Ohioans, regardless of their zip code, have access to high quality behavioral health care. So before we jump into our priority areas, I do want to underscore one thing, and that is how incredibly blessed we are in a more normal budget growth scenario to have ongoing continued investment into our behavioral health field. As many of you probably saw in the budget highlights document on OBM's website, the all funds budget of the governor's budget recommendation has a growth of 2.9% and 1.9% respectively each fiscal year. The introduced OBH, formerly OhioMHAS budget, sees the growth of 4.1% and 2.3%. So we are incredibly blessed to continue to receive resources that help our system grow faster than the overall state budget. And I thank every single one of you for helping to protect and defend and advocate for those resources that we know this field so desperately needs. So moving on to our priority areas. Our budget is focused on 5 key areas: expanding crisis services, fostering resilient people and communities, enhancing quality of care, growing the behavioral health workforce, and increasing criminal justice and recovery services. And we'll go into a little bit more detail for each of these, starting with crisis services. Our goal is to increase the availability of timely, community-based crisis services across the state for Ohioans of all ages. And that starts with 988. More Ohioans are becoming aware of 988, and that has led to continued increase in calls, texts, and chats. As I already said, more than 440,000 since we launched in July of 2022. And that number keeps growing. We know when we first rolled out 988, that 36% of Ohioans were aware that it existed. That's double the national average of 17%. And in May of last year, we launched a statewide public awareness campaign, which has increased awareness and utilization of 988 by nearly double digits. This budget continues to fully fund operation of Ohio's 988 system. We are truly a national leader in 988. And this budget allows us to work toward a state centralized platform that ensures all Ohioans receive the highest quality of care when they call 988. And I just want to underscore how unique that is nationally. We would be one of the first 5 states to manage a centralized state platform for our 988 call centers. Additionally, the budget recommendation allows for emergency telehealth consultation integrated into 988 for individuals who may need additional support. I'll come back to that in just a moment. MRSS, this budget recommendation continues to fund statewide operation of Ohio's MRSS system, which will launch statewide later this year. Additionally, adult mobile crisis services. This budget will allow OhioMHAS, in partnership with our county partners, including law enforcement boards and providers, to build out a statewide network of mobile crisis services for those 21 and older. As we work to scale implementation of statewide mobile crisis services for Ohioans of all ages, we know that it's going to take a moment for us to have those trained behavioral health professionals on the ground in every Ohio county. That is where this telehealth consultation service integrated into 988 becomes so invaluable for Ohioans. We know that the vast majority of calls coming into 988 can be managed by our incredibly talented staff, but there are a rare few that need additional response. And as we work to build statewide crisis services, we want to ensure that we continue to have that resource to meet the needs of all Ohioans, regardless of where they're at, so they don't need a 911 response or to present to an emergency department unless absolutely necessary. Moving on to resilience. We will continue to focus on building resilient people and resilient communities. We will do so by identifying individual and community-based prevention needs to provide Ohioans with education, resources, and services to build resiliency-focused solutions. Given Ohio's reductions in suicide deaths for the first time in 3 years, OhioMHAS is sustaining our investment in best practices to address suicide in Ohio communities. As Attorney General, Mike DeWine's Recovery Ohio plan called for prevention education in every school classroom every single year. Since 2019, Ohio schools have dramatically increased prevention programming, with nearly 100% of school districts reporting that they deliver some kind of programming during the academic year. To support schools in delivering high-quality, evidence-informed programming, OhioMHAS will collaborate with the Ohio Department of Education and Workforce to provide comprehensive, statewide, proven life skills training curricula. We will ensure more of our children have the skills and tools like communication, coping, navigating interpersonal conflict, and self-regulation that they need to be successful academically and throughout the rest of their lives. We want to ensure that all young people can achieve their full potential. SOAR. Thanks to a $30 million investment in this biennium, Ohio has funded truly a globally one-of-its-kind research study into the family, community, and biological factors contributing to behavioral health conditions and to resiliency. OhioMHAS has also seed-funded innovative strategies to address the behavioral health needs of Ohioans. Since 2023, we have invested $4.2 million into 9 research and innovation projects as far-ranging as delivering telehealth behavioral health services to 160,000 school children, training 10,000 coaches on mental health tools to help them recognize risk factors and better support youth development, studying the impact of providing behavioral health interventions via smartphones on young adults, and assisting in the creation of a toolkit to help communities create school-based health centers so that more young people have access to physical and behavioral health care right in their school building. Through this ongoing $20 million investment in the governor's executive budget proposal, Ohio will continue to lead the nation in behavioral health innovation. First episode, psychosis. Ohio is truly a national leader in the delivery of coordinated specialty care for individuals experiencing their first episode of psychosis. If caught early, we believe we can slow disease progression and equip individuals with the skills to navigate their illness long-term. However, prevalence estimates of those with psychosis may be dramatically higher than previously calculated. Data suggests that over 90% of Ohioans who experience a first episode of psychosis don't get coordinated specialty care in the first year following the onset of their symptoms. We want more Ohioans to have access to this gold standard in care. So OhioMHAS will expand our coordinated specialty care program for first episode psychosis statewide. This nearly doubles the number of counties served with this life-saving program. And with the legalization of recreational marijuana, we know that there is a strong connection between experiencing psychotic symptoms in adolescents and use of marijuana. We want to ensure that if prevalence continues to increase, more Ohioans have access to this incredibly life-saving care. Moving on to quality. We will leverage data and continuous quality improvement processes to expand the availability of patient-centered community behavioral health services. I am incredibly excited that this budget will begin to phase in Ohio's statewide implementation of the Certified Community Behavioral Health Clinic model. In partnership with the Ohio Department of Medicaid, we will begin delivering evidence-based practices that are aligned with and responsive to the populations these CCBHCs serve. One of the most consistent pieces of feedback I heard on my listening tour that I cited earlier from both boards and from providers was on the complexity of OhioMHAS's budget. Our numerous funding streams each carried their own reporting requirements, which created significant administrative burden for boards and for agencies that received pass-through funding. Accordingly, we are proposing to consolidate community funding streams into 6 state block grants for our county boards. Those block grants include prevention, mental health, substance use disorder, recovery supports, criminal justice, and crisis to enable boards to have increased spending flexibility and to help us build internal efficiencies. High-quality IT systems. Another way we intend to enhance quality of care is by supporting the availability and use of technology, including electronic health records, within behavioral health agencies. We want to support the procurement of quality IT systems that can empower our providers to better demonstrate the impact of behavioral health care on people and on communities. We know that there is unbelievable work happening every single day across our provider agencies and across our state. We need to be better equipped to help tell this life-changing story of the work and impact of our system. And we believe that through better technology, we can do that. We also know that words matter. And in a recent survey of nearly 300 behavioral health leaders across Ohio, words like addiction and mental health can carry a negative stigma that prevents individuals from engaging with our system. More than 70% of those surveyed stated that behavioral health was more aligned with integrated care and better reflects the field today. Accordingly, Ohio is seeking to follow 27 other states and territories by modernizing our agency name to the Ohio Department of Behavioral Health. Absolutely nothing about our mission will change, but we believe this will help us to continue to address stigma while demonstrating the critical role of our field in improving the health and well-being of our state's population. Additionally, I want to underscore that this name change will not impact the names or structures of any local political subdivision. Moving on to workforce. This budget will continue to prioritize the importance of strengthening integrated behavioral health workforce recruitment and retention efforts by providing training and technical assistance to behavioral health agencies and practitioners. We'll do this through the reimagined Bureau of Workforce Excellence. First and foremost, we needed a workforce assessment. We will complete a behavioral health workforce needs assessment, which is a real-time assessment that focuses on data at the practitioner and provider levels. The data captured will provide both a statewide and regional picture of Ohio's behavioral health workforce environment. Communities will have real-time access, sometimes for the very first time, to this data to also inform their own planning regarding healthcare delivery systems. Driven by the data we collect with the needs assessment, OhioMHAS will provide opportunities to upskill and professionalize Ohio's behavioral health agencies and practitioners. Through the lens of organizational development, OhioMHAS will provide needed technical assistance in areas like human resources, financial management, succession planning, and so much more. Finally, criminal justice and recovery services. Thanks to the governor's workgroup on competency restoration and diversion, there is a renewed spotlight on strategies to address mental illness within our criminal justice system and to ensure that civil patients have access to our state psychiatric hospitals. This budget increases coordinated treatment and recovery supports within Ohio communities to enable individuals experiencing behavioral health challenges to stabilize and to thrive. As recommended in the workgroup report, this budget includes resources to pilot a pretrial behavioral health intervention pilot program, similar to that in Miami-Dade County, Florida. Ohio will replicate this proven pretrial intervention program that delivers competency restoration services, crisis care, life skills training, and other supports to inmates in a diversionary setting, not in one of our state psychiatric hospitals, where the cost per admission is about half that of one of our state facilities. In Florida, participants were also discharged an average of 73 days sooner than those in traditional forensic treatment facilities, and they were 50% less likely to return to jail in the year following community reentry. We truly believe that this is a promising opportunity for us to safely serve individuals in a less restrictive environment and free up beds in our state psychiatric hospitals for civil patients. This budget allows Ohio to continue its strong commitment to specialized dockets. Since Governor DeWine came into office, Ohio has added nearly 90 new specialty dockets, as I mentioned earlier. These include drug courts and family dependency courts that have helped an average of 7,800 Ohioans each year access treatment and achieve recovery, and have helped hundreds of young people in child protective services reunite with their families. And finally, our behavioral health drug reimbursement program. As heard in the governor's workgroup, Ohio jails are seeing an overwhelming need for psychotropic medications and for medication-assisted treatment. As a result, Ohio's current funding for the behavioral health drug reimbursement program no longer can fully cover demand. Through a slight increase in funding for the behavioral health drug reimbursement program and braiding it with other internal funds, We will significantly increase resources to this program and eliminate the need for reimbursement requirements. As we continue to await legislative language for the governor's executive budget proposal, we know that additional questions will arise. We welcome you to send any questions right now or questions that may come up later to budget@mha.ohio.gov, and we will get back to you as quickly as we can. I want to thank you so much for your support of this truly remarkable budget for Ohio's behavioral health system. We have a few minutes to answer some questions, so I will turn it over to my colleague Doug Day to let me know if there are any questions sitting in the budget@mha.ohio.gov inbox.
Thank you, Director. Excuse me. We have not received any questions yet, but we might want to give a moment to see if we have any come in. As you've mentioned before, to remind everyone that the budget@mha.ohio.gov mailbox will be open even after the webinar today, so you can please submit any questions when they come to mind. Still nothing has come in yet, Director.
We will post this webinar and additional budget documents to our website after this meeting, where you all can visit it, mha.ohio.gov. It's under priorities and our About Us section. So if you all are looking for this presentation, for this slideshow, or any additional information about our budget, you can find that information there. Again, any additional budget-related questions can be directed to budget@mha.ohio.gov, or I welcome you to reach out to me, to Vanessa McMahon, our External Affairs Deputy Director, Mackenzie Pickrell on our legislative team, or any other member of our staff here at OhioMHAS on our executive leadership team. We're happy to field any questions that you may have. So once again, Doug, unless there are any additional questions.
Director, we're okay at this moment. We will continue to monitor the mailbox and respond as efficiently, expeditiously, and accurately as we can.
All right. Well, thank you all for your time this afternoon, and we look forward to partnering with you to advocate for these critical resources for our behavioral health field. Thank you so much and have a great afternoon.